Well, hello and welcome to another Thursday and the first Thursday of October 2025. I have now date stamped this video. Welcome everybody to the Association of PEMF Professionals. I am Dr. Jerry Dreessen, the Executive Director here at the AOPP headquarters, and let's just dive right into it. Today we're going to be talking about, we've kind of talked about this in the past, but as far as triaging your PEMF plan. And so we've had a lot of great feedback from people, and they've been asking about, when I'm out there doing sessions, how do I go about doing that? Or even if people, if you have your own device and you've got your neighbors coming by, just having that information is good to have. But of course, we're always pushing you towards becoming a member because there's so much stuff going on. And in fact, we'll talk a little bit about our PEMF con that's coming up. I've got that information coming up too, but it should also be in the down in the description, whether you're on LinkedIn or YouTube or Facebook. So with that, let's just jump right into this part of it. So it's a simple framework for safer, clearer PEMF protocols is what today's talk is about. And those of you that are watching, if you have any questions along the way, drop them into the comments. This is live, so I'll be able to take a look at that and answer it on the fly, which is good. So why triage matters and some key guardrails. So basically having the right protocol in the wrong stage, then you're going to have poor outcomes. So if you can get a simple triage map to use, whether it's in your head or you've got what's going on here, and we'll talk about like acute and chronic versus maintenance. So those are the three big ones. So, what do you do for an acute problem? What do you do for a chronic problem? And then what do you do for maintenance? So we have the deliverables. So you can have a card, you can have a progress sheet that you've got, just a quick tick off the question kind of thing. Again, those of you that are members, we have these things in the membership site. If you can't find them, let us know, give Lauren a call. And again, red, yellow, green flag lists. So anytime you hear broken bone or pacemaker, those are the red flags. If it's artificial hip or artificial knee, those are yellow flags and things to be used with caution. I had a patient ask me yesterday, he goes, "Can I use this on my knee? I have a fake knee. Is it going to spark?" And a lot of people think that metal things are going to spark or light up or, I don't know, in their science fiction mind, what's going to happen. And we know that those that have any kind of metal implants, it just warms the metal up a little bit. So, and then also if you can have your device, I guess if this was the knee, where am I? If this was the knee, you can have something above or below it versus over it, depending on where the problem is. We'll talk a little bit about that too. And again, this is for education only. Follow the device rules. So if you have whatever rules your device comes with as far as what you should or shouldn't do. And if you have any questions on what we're talking about, again, get in touch with us. If you've got a client or an animal that's got some sort of a implant or artificial limb, again, work with the owner and then, focus on clear surfaces and document everything if you're out there in the public as a business. So that's the biggest thing. We've broken this down in what we call the S.T.A.G.E triage framework. And so S is for screen. So this is where you're looking for contraindications, implants, meds, recent surgery, all of the things that could become a red flag. So you get to say no right at the start versus halfway through. People are saying, "I'm feeling kind of sleepy," or "I'm feeling kind of nauseous." And they didn't tell you that they were taking some kind of medication that if they take too much of it, they're going to have some sort of a nauseous reaction, or usually on the medication, it's whatever the overdose caution is. Using PEMF may start that because the medication they're on is going to be absorbed better. So they're going to 2x their medication sometimes. So, having them drink water, and be aware of using PEMF, I would recommend reducing the care or the power somebody that's on a medication, and do a small trial to see how they feel. Tag the stage. So here they are. Is it acute? So are you the stage of treatment or stage of sessions? So with acute, there's days to weeks. Chronic can be months. And then, of course, post-op surgery, maintenance, those types of things. And so if you can have like a 30-second speech, or if somebody says, hey, I'm 8 weeks post-surgery, can I do PEMF? You should be able to answer that. If they say, tomorrow I'm having root canal surgery done, can I see you right after that? You should have an answer for that. Those of you that are wondering, yes, you can do post-op, day of, second day PEMF, but there has to be certain parameters that are laid out. And of course, light, gentle, depends on where the problem is and if it's bleeding. So being able to look at the site, but usually PEMF low and slow on an area that's inflamed, it'll reduce the inflammation, because PEMF goes right into the cellular structure, mitochondria, gets your system working, performing at 100% capacity, and the tissue starts to heal faster. As far as the aim, you've got your functional and symptom markers. So, can they move the joint? Can they bend the elbow, bend the leg? Is it tender to touch? Is there a large red area? Animals are usually really good at letting you know if something hurts, because they will bump you or bite you, right? Humans, thank God, don't do that. But again, on your sheet, here's the problem. I'm seeing red. The red is, 3 inches by 3 inches. It's 3 fingers above the elbow. There's no cuts or abrasions. It's just a bruise. And then the more you can paint the picture or take your phone and take a picture, the better off you are. So the guardrails, of course, as far as placement limits or dose and spacing and when to pause. So when you're first starting out, I really like to have a first time on slow. Even they go, Doc, can you turn it up? And of course, my famous story is working with a chiropractor, low back, disc problem, in a lot of pain, low and slow. I'm working on some patients. I come back and he's got the machine turned up 2 or 3 times what I had it at. And he goes, oh, I can really feel it now. And it's like, oh man, you've just messed yourself up. And he goes, what do you mean? I said, you're squeezing that disc and you're going to squeeze out some of the fluid. That fluid's going to get on your nerves. The nerves are going to react to that. Your muscles are going to spasm. You have burning down your leg. You've just created a major problem. And he's like, nah, I'll be fine. And then I got the phone call. It's like, yeah, you were right. I'm in a lot of pain. So I don't know if that means like your device, if you can like put a cap over it so they can't touch it, that would be good. Or even have them sign a form saying, I will in no way ever touch the machine. If so, I do so at my own peril. Just something like that would have been great for this guy. But as far as the last one, elevate. So, preset the checkpoints. So here's what you have. Here's what we're going to do. Here's the results we're looking for. I will be measuring the joint. I'll be taking a picture of it. I will be, whatever it is you need to do along the way, so that as you are performing these events, sessions, that you can log in the changes that are made. Often people don't realize there's been a change until you have it pre and post, and then they'll go, wow, you're right. There really is a change. I didn't realize before I could only bend my elbow, to 90 degrees. Now I can go 120 degrees, 125 degrees, and you got that measurement to prove that. So those are why we do these measurements. The playbook, again, as far as to calm and protect, but to reduce the irritability, the edema, protect sleep and movement. These are some things that you can explain as far as the cadence and the dose. So short, frequent, brief sessions, avoid high power, symptom site and the driver region. So oftentimes, like, where are we putting it? Is it right on the site? Are you going to move down the line, closer to the spine with it? Or are you going to go further out? Some of those things, aftercare, hydration, some gentle range of motion, sleep, no heavy stacking. Like, now that you've done that, and there's a great Far site. Maybe I'll post that, but it's the woman saving Timmy from his trike going into the snake pit. And it's the dad's reading the paper. He goes, oh, thank goodness you stopped him. He would have gone into the snake pit. And I have that in my clinic for patients to see. And now that you're getting better, I don't want you jumping back into that snake pit, because people will do that. It's like, wow, I felt so good today that I decided to take care of the 5 things I've been putting off. So I did laundry. I got up on the roof, got rid of the leaves, went over to my neighbor's house and helped him, load his engine in the back of his truck. It's like all of these things because they feel so good, but the body's not ready for that yet. It still hasn't been conditioned. So those are the main things as far as aftercare. And again, hydration, really important before and after. Those of you that are out on the field, you probably are bringing your own water to give people to drink if they don't have access to it. And then what are the checkpoints? Is the decreasing, is the swelling decreased? Is the sleep and comfort getting better? Are there small functions that are happening that are a win? And then if you don't see certain things, or you do see certain things, that's your red flag. So to hold or stop. So are there any pain flags, or like my fingers are tingling now, those kinds of things. Or if there's some sort of infection that they had that you weren't aware of. So those are when you need to halt and consult. As far as on the chronic side of it, this is where you're working on them for months, and it could be 2 or 3 times a week. It could be once a month, but you're building some kind of consistency. And again, the aim is to help decrease the possibility of things flaring up, and it can be 2 to 3 times a week. I have a patient that had a broken bone on their shoulder. We did daily, and then we went to 2 to 3 times a week, and then it was once a week, and then it was every other week. So you see this tapering off of care based on the function as far as what they've got going on. Again, dose strategy. I have people that have been with me for years, and they're still on very low. That's just what their body can handle. They can't handle more. They go into a lot of detox. Some of them are on a lot of medication. So you can fly under their radar by going low and slow and just staying there. And they still feel great comfort. And they keep coming back because it does make them feel better. So we've never taken them over a certain amount, because knowing that their medication absorption will kick in. So those are, again, things to take in. I'm lucky enough having it at my clinic that I already have their travel card. So I have all of that notated. So when they come in, I see what we've done in the past and what we're doing, what the schedule is, so that I don't have to commit everything to memorization. Lifestyle stack. So, what are they doing? What's their job? Are they sedentary? Are they out, digging ditches? What's their lifestyle? What's their weekend stuff? Do they ride motorbikes on the weekend? Those are some things to know too, because they can come back and say, yeah, this isn't working. And you can say, well, aren't you like doing motocross on the weekends? You're irritating the area. If anything, we need to do more or longer. Those are some things to take into in advice. Checkpoints again in the auto accident. As a chiropractor, I initially do all of this orthopedic neurological tests. We take x-rays, show ligament damage, and then in 30 days, we do all the tests again. And that shows they're getting better, they're getting worse, they're staying the same. Those are the three options. And if they're getting better, then we know that what we're doing is working, so we can continue on. After they've reached a certain point towards getting better, then we can reduce care, less frequent. But every 30 days, we're always doing that. Now, for you, if that is every 2 weeks or every week, you can do that. You can say, let's do this again in a week and see how you're doing. Oftentimes, that's what is needed. And I'll do that with a patient too. It's like, I know we're not scheduled to do a re-exam in 30 days, but you're doing really well today. Let's just do a quick measurement and see how you're doing. And now they can move. Their rotation was at 45 and now it's at 60. I mean, that's a significant amount of change. To them, it may not be that much, but if I can show them that you've just increased your range of motion 20 degrees, then they realize that what we're doing is working. And that's what you want to do too with PEMF, is to show that it's working. And then as far as your decision, it's like, now that we've done this, I recommend that we do blank. And so being able to, that's part of it too, is knowing what to recommend and to have that idea on sprains and strains, bumps and bruises, general aches and pains, chronic arthritis, what's your standard protocol, and to make that, create that so that people can see that. As far as tapering, and again, like I was talking about with chiropractic care, we taper out as they're getting better, but we're also introducing exercise to strengthen everything too. And so with PEMF, as they're getting better, they'll do more. If they're working with a doctor, if you can be working with them too, that's a great way to get a great relationship with a healthcare provider and cross-refer. Those are some really cool things. But as the goals are being met, then they're pretty much, let's keep things moving well with a maintenance program. And then if they ever have a flare-up, then, you can jump in and do more. So again, consistency beats intensity. So small steps add up. So you don't necessarily have to go in there hitting them with everything hard. It's like, well, I have patients that'll come in. It's a Friday. Hey, how you doing? Great. Hey, I'm going to be gone next week. I'm going to Ireland for a week. So I came in, my back's been bugging me for about 2 weeks now. I just need to get it adjusted so that I feel good. And so I've got 1 day to try and get them back to normal, because they're going to go do something. And you might have that too. It's like, well, I'm going to be gone, so I won't be able to come in for this care program that you have. So as long as they realize that you explain the truth behind the physics of the world of life, I'll say, when you get cut and you bleed and you got this cut on your arm, do you expect it to be completely healed the next day? Inside things are like that too. So I will definitely get things better, but they won't be fixed. And, that way they don't leave or start care with this huge expectation that you're going to be the one that gets them up and running. Although I do have people with low back pain coming in, they use PEMF and they stand up and they look around and they go, what is this? And it's like, half my pain is gone. And then I'll tell them, that's good. Don't go out and mow the lawn. Let this thing do its, let the inflammation stay for a while. Don't recreate more inflammation in the area. And then as far as the post-op, so these are, people that have gone through care or at the end of their phase, or they may be seeing you after an injury and they're doing physical therapy. You can help that out too. So again, support comfort, circulation, and then also respecting the tissues of the area that you're working on and also the devices that you're using. You may have written guidance on timing and things like that, or you may provide that to them, and there may be things that are going on. Let's say that they're post-op and they're like the scar from the incision. You may want to stay away from that. Again, depending how deep it is, there's a couple of things to think about, but there are times when you can use it and times when you shouldn't use it. And again, as a member of the AOPP, you get taught all that. But bottom line is, you don't want an area that, to twitch if there's a cut with stitches. Low and slow, you want to help increase vascularization of the area, which will help it heal faster. Sometimes the doctor's like, wow, we got to get these stitches out right away because you're healing faster than the stitches. And so I've had some people have their stitches taken out sooner, but again, they're working with their healthcare provider that did the surgery on a more frequent basis too. Regional adjacent for edema, so avoid hardware sandwiching. So just make sure that you're not compromising other areas that may have problems, that you're focused on that you can blanket distance and create more of a padding to absorb the PEMF so it's not getting close to other areas. And again, documentation, document, and then also pause or notify if there's any kind of fever or drainage. If there's a pain escalation, it may not be PEMF. That's the other thing. Patient reserves the right to have more than one thing going on at the same time. So just know it doesn't have to be you. Had you not done PEMF, that would have happened anyways. So that's the main thing. It would have happened regardless of you being present. And as long as they know that and they're aware of that, then you're good. Miscommunication has always been the key of any doctor, patient, provider relationship, PEMF, session provider, all of us that are in that. Communication is the key. And then as far as some real world stuff, so on a human side, lumbar pain, you can decrease the pain, you can help with the nerve system, the inflammation like sciatica, those things. And then checkpoint at visit 4, you want to retest like I was talking about. Chronic with a knee, you've got some inflammation and pain, and your goal is to do 3 times a week. You can do different replacements of what your attachments, and then also you've got your markers like above and below. And as things are getting better, range of motion, then you can help with that osteoarthritis going on in the knee. Post-op cases, human knee, and also vet canine. So oftentimes with animals, and we've seen it in dogs, they just get up and run around. They've been sitting around, all of a sudden they're up and they're back doing their job. If they're herding sheep, or if they're a dog doing an event, they don't have a complaint anymore or limp. Our cat has a bad shoulder, and she'll hop up on my wife's lap when she's using PEMF on her hip, and just snuggles up real close, and then afterwards jumps down and there's no shoulder limp going on. And so those are some really cool things that we see. And then the takeaways is making sure that you have everything staged properly. Again, doing your diligence, getting your paperwork down. We oftentimes don't do that if they're family members. It's just like, sit down, let's put this on there. Yeah, I feel better. Great. And so there's a different relationship with family than you would with a paying client. But you can set some markers. It's like, well, let's get your elbow from 90 to 105 degrees. Let's work on that. And those of you that are in the course, that there's static and there's active, and active with weight or resistance. So those are some things you can throw in there too. And then reassess on the schedule. Let's get you, to this next visit. We're going to do an exam, see how you're doing. You should see some better results. So that's kind of an overview on that. We've gone about 24 minutes on this too. So thanks for those of you that are hanging out. I see we've got lots of people joining us today. But the big announcement, we have our PEMF Con, PEMF Con 2025. And we have on our website, PEMFprofessionals.com. We've got a link, PEMFCon-2025. It's got all the information that you need to see. Tickets are $200 for non-members, and AOPP members receive a discounted rate for the 2-day event. It is November 5th and 6th. You'll see a list of some of the speakers that we have lined up. We're also still in the process. We got 1 or 2 more that we're going to have there as well. We've got lots of great vendors that'll be there too. It's all virtual, and it'll help deepen your understanding of PEMF, clarify some safety safeguards, but also level up your practice. That's the goal. You'll have a chance to go and do breakout sessions with the speakers and ask questions. That's the goal. If not, then also just have some Q&A set out that we can get answers to you. But as we have done in the past, there's no hype and it's all substance. And we are a organization that is all about all PEMF devices, all users, all walks of life, and to bring you the truth on PEMF and what it does and how you can use it. So join us. We'd love to have you there. I'll be one of the speakers as well. Tell other people about it. We had a great turnout last year, and we expect to have more, if not double, what we had from last year, because there are more of you. And those of you that are thinking about it, you can definitely drop in and become a member, PEMFprofessionals.com. You can get your certification, human, small animal, large animal. We have infrared. We have all those certifications that you can get from a international organization. So we're in 17 countries. If you didn't know, we've got people in other countries that are using our certifications, but it is literally a badge that you can take with you to get into events, to have certification from the AOPP. If you have any questions or if you have any tips for us, definitely jump in, info@PEMFprofessionals.com. Send us an email to Lauren, and if you need something from me, she'll pass it on as well. And again, no like and share if you want to. Today's talk, we've got a couple of things out there already on Instagram and Facebook that talk about PEMFCon, so you can just go there and share that information, or add somebody, do an their name so that they can see it as well. We'd love to get a lot of people going to our event here, live event on Zoom. And with that, I want to thank you again for your time today, and I look forward to talking to you next week. All right. Thank you. Take care and enjoy the first month of October, and just enter below if you're a pumpkin latte fan. All right. Take care.